Hello, my name is Joseph Gerbel, baccalaureate student at Indiana State University. I've created this short presentation as part of my community health nursing program for somatic symptom disorders education, population at risk, people with previous, current, or risk factors for somatic disorders. After viewing this presentation, viewers will be able to identify somatic disorders, differentiate between somatic disorders, explain etiology of somatic disorders, identify somatic disorder interventions. We will review what are somatic disorders, overview of somatic disorders, etiology, psychosocial factors, interventions, and a couple related disorders. Before we go any further, please pause this presentation, click the link below the video. I've developed a short pretest to assess your current knowledge about somatic disorders.
What are somatic disorders? Somatization is physical symptoms of psychological stress evident by pain, rashes, decreased muscle function with psychological causation. Continue to confuse both patients and healthcare workers due to its complexity. Somatic disorders have been around for an extremely long time, though few studies have been performed and much information is still needed. Can cause major impairment, even paralysis, with no known causation. Have strong negative stigma due to the limited evident causations of disorder. The American Psychiatric Association recognizes 5 somatic disorders, including somatic symptom disorder, illness anxiety disorder, conversion disorder, psychological factors affecting medical conditions, and factitious disorder. I will explain these further on the next slide.
Somatic symptom disorder is characterized by a combination of distressing symptoms and an excessive or maladaptive response or associated health concerns, without significant physical findings and mental diagnosis. More common with younger 16 to 25-year-old women with psychiatric disorders. Often feel medical assessment and treatment are subpar due to inability to give clear diagnosis. Illness anxiety disorder, which is formally named hypochondriasis, people misread physical symptoms for serious illness and disease. Anxiety and depression is also the cause of this disorder. Conversion disorder, display of neurological symptoms without available neurological diagnosis, often with loss of motor and sensory function. Often has a history of abuse as a child and additional psychiatric conditions. Psychological factors affecting medical conditions is also considered a somatic disorder. The increased severity of medical conditions by psychological factors. Etiology. Somatic disorders are complex and often have a history of traumatic experiences. It brings attention to larger psychiatric disorders which need mental help. Research has shown that has genetic factors. Psychodynamic theorists believe it is related to repression of previous experiences, Behavioral theorists believe it is due to the learned helplessness and means to manipulate. Cognitive theorists believe that people over-obsess about body senses causing these disorders. Different cultures sense these feelings in many ways, such as people in Africa and Southern Asia that report feeling a burning in the hands and feet or worms in the head. Psychosocial factors. Poor coping skills to deal with stress and previous experiences increase risk of somatic disorders. If somebody is spiritual or religious, this can help give strength to overcome the mental troubles causing these physical symptoms. People with somatic disorders at times see secondary gains caused by their ailment, such as more attention or care. At times, people with somatic disorders that feel what would be a normal sensation interpret it as a major complication to something much bigger. Encouragement to communicate emotional needs and feelings is greatly important. A short list of some interventions that can help with somatic disorders. Gaining knowledge on coping strategies to improve functioning and ability. Promote self-care activities, which will help build self-empowerment and prevent helplessness. This is individualized to the physical symptoms being presented. Research is still needed to tell the effectiveness of medications with somatic disorders. They can help reduce severity, though people with somatic disorders are at high risk for abuse of medications. Health education can be effective, especially regarding body functions. This can help people make sense of what they are feeling. Case managers are helpful to reduce amounts of visits, lab tests, and etc. to doctors' offices. They are also helpful to reduce overall costs. Therapy can be effective to manage psychological causation of these physical symptoms. Factitious disorder. Somatic disorders are not under conscious control, though fictitious disorders are when people pretend to be ill to obtain the status of patient. Malingering is the term used when somebody makes up symptoms of a disease for material gain, such as to get out of work and get on disability, or get money from insurance companies. Please take this time to click the link below this video and retake the quiz to see what you have learned about somatic disorders.